In this episode of Anatomy with Amy, we're going to be talking about the rotator cuff muscles. There are 4 rotator cuff muscles. We're going to break each of them down. We're going to talk about their bony attachment points and their action. The first one we'll start with is supraspinatus. So supra, making reference to above, and then this part of the word spine is making reference to the spine of the scapula, which is on the posterior aspect. So above the spine of the scapula is the supraspinatus fossa, where supraspinatus originates. The muscle belly then becomes tendinous as it passes underneath the acromial arch. So if you're palpating this muscle, as you move more lateral towards the acromion, you'll lose a portion of it as it passes under the acromial arch. It comes out and attaches onto the superior facet of the greater tubercle of the humerus. So we can find that if you palpate just on yourself, if you find the tip of your shoulder, so on that lateral aspect of your shoulder, you can find the tip of the acromion. If you strum superior to inferior, you can feel a bony ledge. That ledge is the acromion. If you drop just inferior from that acromion process, so here's the acromion, here's the greater tubercle of the humerus. This is where the attachments for 3 out of the 4 rotator cuff muscles are going to live. So there's 3 facets on the greater tubercle. There's the superior, middle, and inferior. So supraspinatus has attachment onto the superior facet of the greater tubercle of the humerus. When we talk about the action of this particular muscle, what it does is it initiates abduction. So in some ways, this has a similar action to deltoids. So our muscle here, our shoulder muscle. Deltoids will do abduction directly out to the side when all 3 fibers are firing. Supraspinatus is a little bit unique in that it initiates abduction. So it's going to start to bring that arm away from our side for us, but it does so in the scapular plane. And so what that means is it's not taking the arm into straight lateral abduction. It actually comes out on a bit of an angle in that scapular plane. And how we find or discuss that scapular plane is that when we look at the shape of the rib cage, it's rounded. It is not a flat structure. So because it's a rounded structure, the way that the scapula sits on that rounded rib cage is not flat to the back, but rather it sits around it in a curved manner. So when we engage supraspinatus, it initiates abduction. So it starts that lifting of the arm, not in a direct lateral plane, but in that scapular plane. The importance of the tendon coming underneath that acromial arch, we will discuss in another video. When the humerus and the shoulder are not sitting in a neutral location, and if we're doing a lot of overhead work or a lot of work where we're raising the arm, it can put a lot of tension and friction on that particular tendon. It rubs up against the acromion, and so that can create some issues for us. So we'll talk about that in another video. So the next one we're going to look at is infraspinatus. So infra, making reference to below, and then this part of the word spine, making reference to the spine of the scapula. So below the spine of the scapula is our infraspinatus. Infraspinatus originates in the infraspinous fossa. And what's important to know about this particular muscle is that as it travels towards its attachment point, it goes up and over the shoulder, up and over the humerus. So if we were to look at that from ourselves, if I've got my spine of the scapula here, just below that is infraspinatus, and that muscle belly and then its tendon comes up and over top of the shoulder. And this is significant for us to know because where that muscle belly and then its tendon travels will dictate what type of action it does. So when we have muscles that come up and over top of the shoulder in this manner, so from the posterior aspect of the body coming forward and over top of the humerus, Typically those will perform an external or lateral rotation. We're going to look soon at some muscles that travel underneath the humerus. So they originate on the back and they travel underneath, like through the axilla, and they have attachment onto the humerus. And anything that travels underneath the arm like that will typically perform an internal or medial rotation. So if we're talking specifically about the infraspinatus, it travels up and over top of the shoulder. Its tendon will then attach onto the middle facet of the greater tubercle of the humerus. And as I mentioned, because it comes up and over top of the shoulder, this particular muscle will perform external or lateral rotation. Similar to this, the infraspinatus, and to take a look, so I'm pointing at the right one. So we've got, you can see a portion of its muscle belly here. Unfortunately, this model, I can't peel that off for you to see it, but you can see a portion of this muscle here that is peeking out by infraspinatus. This is our third muscle in the rotator cuff, and this is Teres Minor. So Teres Minor is going to come off of the lateral border of the scapula. I can't peel it off in this model. So you'll see here that it has a similar direction, fiber direction to infraspinatus, and that's significant because that's going to give us a same action as infraspinatus. So it's going to originate off of that lateral border of the scapula, and then it comes up and over top of the humerus. It's going to attach onto that third facet. So more specifically, it's the inferior facet of the greater tubercle of the humerus. And because Teres Minor comes up and over top of the shoulder, similar to infraspinatus, it is also going to perform external or lateral rotation of the shoulder. So we have two muscles that are both going to perform external rotation of the shoulder. And then our final one lives on the anterior aspect of the scapula. So we can't access to palpate much of this muscle. This is subscapularis. I'll put that on the board first and then we'll talk about it. So sub is making reference to below, okay, or on the back side, and then scapula, it's on the bottom side of the scapula. So because this lives on our back, this portion is actually the anterior aspect. We can palpate a good portion of supraspinatus. We lose a bit under the acromial arch. We can palpate infraspinatus and Teres Minor, but we can only touch a portion of subscapularis, and we can touch a portion of it as it comes out. So from this lateral border, if our patient is laying supine, we can palpate along that lateral border as it comes out there. And what's important to know about this one is that it tucks underneath the humerus, which, as we just briefly talked about, will do a different action than the previous two muscles. So because it comes out from the anterior aspect of the scapula, it comes up and under the humerus. It has attachment onto the lesser tubercle of the humerus. So this is the only one of the four muscles that doesn't attach to a facet on the greater tubercle. This particular muscle attaches onto the lesser tubercle of the humerus. And because it travels underneath the arm and has attachment onto lesser tubercle, the action of this particular muscle is internal or medial rotation. So those are the four rotator cuff muscles. Some good detractors on tests that you might see are asking about Teres Major. So we have Teres Minor, and then really close to it, we've got Teres Major. So that is a good detractor. Sometimes I'll use that on my evaluations when we're talking about muscles of the rotator cuff. So don't mistake major for minor. Major is not part of the rotator cuff. It mimics closer to lats. And that's about it. So I'll also point out You may also hear the rotator cuff muscles referred to as the sits muscles. So S-I-T-S. Sometimes they're referred to as the sits muscles. And these muscles are clinically significant and important because they provide the support for the stability of the glenohumeral joint. And we know this particular joint is rather unstable. It does rely quite heavily on muscular support to stay intact. So the muscles that we really want to focus on strengthening, if we're going to pick some more than others, for people who do a lot of overhead work, who do a lot of repetitive type work, you may see some overuse with the supraspinatus, so it might present as a supraspinatus tendinitis. So once that tendinitis is taken care of, then we want to work on strengthening supraspinatus. I would say the two muscles that we really focus on the most when it comes to supporting the shoulder, but also supporting a really quality posture, is infraspinatus and teres minor. So that can be done with an external rotation exercise. You can find that in some of my other videos. And then I would recommend a lot of stretching for subscapularis. So there are quite a few muscles and larger muscles, larger than subscapularis, pectoralis major being one of them, that pull the shoulder into like an internal rotation. So if we can work on creating length in supraspinatus, length in pecs, and then we work on strengthening the external rotators, that'll help us in a neutral postural position. So I hope you got something out of today's video. Check out the other ones for more Anatomy with Amy, and we'll see you again soon.